Hello friends, I am Dr. Deepak Saha. I am a senior consultant and interventional cardiologist in Virinchi hospitals, Banjara Hills. Small introduction, I have done my MBBS and MD in internal medicine from Odisha, and then I learned my interventional cardiologist and got trained in DNB cardiology from Delhi. I worked as an assistant professor in the Department of Cardiology from one of the prestigious institute, Nizam Institute of Medical Science in Hyderabad. I worked there for 5 years, and after 2 years stay in Kamineni Hospital in King Koti. Right now for last 6 months I have been working in Virinchi Hospital, which is one of the prestigious upcoming hospital in Hyderabad. Today we have gathered I want to give a brief introduction heart disease. Basically my topic will be more on prevention aspect of heart disease. As we all know, the heart disease has become a huge burden in our country, and it almost occupies more than 20% of all admissions in various hospitals, both corporate and government hospitals in India. It has been increasing to an alarming level and it now, earlier what it used to be involving in the 5th or 6th decades of life, nowadays we are seeing more and more of young people, especially in the 4th or 5th decade, in the early 40s, to have been contracting heart disease. Once the heart disease is done, then more the heart gets weak and it definitely incapacitates someone's life. Majority of the focus till now in India and other countries had been in the management of the heart disease. That is, once the person has a heart disease, how to manage and bring him out of this heart disease, or how to use the best practices so that he can live with his heart disease. The focus has not been much on the prevention aspect of heart disease. So once the patients develop a heart disease, we don't have much to do. We just have to take care of the heart. We take care of allied things like diabetes, hypertension and other aspects. Quality of life is definitely not to his peer fellows. So today I want to discuss a few aspects of prevention of heart disease, because that is the best way one can do in preventing heart diseases. At least if the heart disease are not prevented, at least it can be delayed for another 1 to 2 decades, so that they don't suffer from a major heart disease in their early 40s or 50s. Before speaking about the prevention aspect of heart disease, we should all know what are the risk factors that leads to heart disease. As we all know, by many multiple trials done in Western as well as done on Indian patients, it has been shown that there has been many risk factors that leads to heart disease, out of which 3 or 4 are non-modifiable, where we cannot do anything, and there are some 8 or 9 modifiable risk factors where it definitely helps in reducing the burden of heart disease in India. Non-modifiable risk factors are, as we know, age, where we cannot change the age of a patient. It has to go on increasing, and being a male person definitely gives you more chances of heart disease, especially in your 30s and 40s, where the women are slightly protected because of the genetic factors, like if someone has a family history of heart disease, the genes cannot be changed, but definitely the genes can be modified, so that we can modify the risk factors. So one who is genetically prone for heart disease, the disease can be delayed for some time. Coming to modifiable risk factors, as we all know, there are few diseases like diabetes, hypertension, hypercholesterols, smoking habits, lack of physical activities, dietary patterns, stress. This all leads to heart disease. So coming to one after another, how we can prevent the heart disease is by modifying these risk factors. The most common risk factors is smoking. Now this is clearly a modifiable risk factors. One can definitely reduce the chances of heart disease by as much as 40 to 50% if someone just stops smoking, who has been a chronic smoker all throughout his life. So smoking in generally causes 2 to 3 times more proneness for heart disease, and especially in India, where the young smokers, they start smoking at the age of 15 or 16 as a teenager, and by the age of 35 to 40 they have been smoking for 20 years. Definitely they become more prone for heart disease, as well as many other lung diseases like chronic obstructive pulmonary disease and cancers. So it is very important that the education should be going that the hazards of the smoking. We though have a cigarette packets where it is clearly written that smoking causes cancers, but we need to be more aggressive. The government needs to be more aggressive so that it can reduce the smoking habit of the people. By reducing smoking, even if you are smoking for 20 years and if you stop smoking, then you can reduce your chances of heart disease by as much as 30 to 40% if you stop smoking for another 10 years. So that is a huge benefit one can do. Without medicines, nothing, just stop smoking, your chances of heart disease is reduced by 40%. That's one of the second risk factor is diabetes. We all know that diabetes has become more and more rampant in this country, and because of our lifestyle, it is increasing day by day to a very alarming level. India is now considered as the second most populous country with patients of diabetes after China, and if the trend goes on, it may surpass China in having the maximum number of diabetic patients in the world. One of the most common cause of diabetes has been the physical inactivity and the rising obesity in the people. So how the diabetes leads to heart disease? Because of the diabetes, the blood sugars in the body remains high, and it start damaging the small blood vessels all in the heart, kidneys, brain. So when the small blood vessels in the heart gets affected, it leads to an inflammatory changes and deposition of cholesterols in the blood vessels of the heart, and over time it leads to blockages in the heart leading to heart attacks. So basically, how we can prevent, we cannot completely cure diabetes, but at least we can control the blood sugar levels in patients of diabetes, and that will retard the aggression of diabetic heart disease, so that the chances of developing blockages in the heart is reduced or at least delayed to a long time. So it is very important that once you have a diabetes, you should regularly check your sugar levels, try to control the sugars to optimal levels, so your chances of heart disease or heart attacks are delayed or at least reduced by a large extent. The second thing is the hypertension. We all know at least 20 to 25% of people more than 40 years of age are now suffering from hypertension. Hypertension has a direct correlations with heart disease. The more the blood pressure, the more the chances of the heart disease. And it is a very simple way of measuring blood pressures. It can be done by any physician or any PHC levels where the blood pressure can be measured. And we have now many effective blood pressure medications where the blood pressure gets reduced, and definitely it reduces the onset of heart disease in the future. Normally in countries like India, where the blood pressure awareness is low, it has been seen that half of the Indian population, they are unaware that they are having high blood pressures. Half of the Indian population, they know that people with blood pressures are unaware that they are having high blood pressures. And out of this 50% who are unaware that they have blood pressures, they don't take the effective blood pressure medications to control the blood pressure. That is another 50% reductions. And out of this 25% who are aware of the blood pressures and they take the medications, the blood pressure is not adequately controlled in another 50%. So basically, even if the person is suffering from hypertension, only 12 to 15% of these people are effectively treated with blood pressure medications. There are many reasons because of the compliance of the people not taking the medicines. Some alternate medicines, too much rely on alternate medicines where they don't check the blood pressures, they don't correct their dietary habits, they don't go for regular exercises which is recommended in cases of blood pressures. So this all leads to a long standing blood pressure changes leading to heart diseases. So the best method is you should, once you know that you have been blood pressure, you should modify your lifestyles, you should reduce your salt intake, you should go for regular exercise, and you should regularly take your medicines. This will itself reduce the chances of heart attacks and heart disease by as much as 50 to 60%. One of the more common reason that has to be stated is the high cholesterol levels. It has been for last 5 to 6 decades where it has been shown that high cholesterol levels leads to heart disease. There have been some controversies thinking about the high cholesterol levels, whether how is directly related to the heart disease, or there are some underlying bystanders which causes more of heart disease. But whatever, once the cholesterol, whether it directly causes a heart disease or is just a marker of patients having likely to develop heart disease, the cholesterol levels should be checked. Once who has been in the high cholesterol levels, they should be change their lifestyles, they should improve their dietary pattern, reduce the oil intake, reduce the right type of food they should intake, avoid foods which has high cholesterol levels, like the junk foods we have been eating. Those things has to be reduced. And the other thing is, we can take care of physical activities, which also leads to reduce cholesterol levels. By reducing the cholesterol level, we have effective medicines which we call as statins, which reduces the cholesterol levels to a great extent and reduces chances of heart disease by as much as 30 to 40%. One of the other risk factors for developing heart diseases, especially heart attacks, is the rising obesity. The people are getting fatter because of the lack of physical inactivity, because the lack of time they cannot devote towards their physical activities. The people are gaining weight day by day, especially their eating of junk foods, taking high calorie diets, eating more of carbohydrate diet rather than taking fats or proteins. This all has led to increasing obesity. Obesity has been clearly shown to causing heart diseases, especially heart attacks. Then again, there is an interplay between an obesity which also gets linked with diabetes, hypertension and hypercholesterol. So overall, obesity in the directly or in lieu of with other risk factors like diabetes, hypertension and hypercholesterolemia leads to heart disease. So taking care of your own weight, so one should know what is their BMI, that is body mass index, which is a weight divided by height to the square of height. One can calculate his body mass index. It is ideal to keep your body mass index between below 25. If it's more than 25, it leads to heart disease, and it is definitely there is an exponential rise when it goes beyond 30. How we can reduce? We can avoid all the food that leads to obesity, like junk foods like burger, pizzas, cold drinks, ice creams, and all the packed foods what we eat, just like chips and the lot of mixtures and all these things. This should be avoided into causes heart disease. Along with that, one should increase the physical activity either in the form of their workplace, or they can do a regular training program as good as walking daily in the morning for 20 to 30 minutes. This all leads to reduction in obesity and ultimately reduction of heart disease. In the workplace, one can take stairs instead of the lifts, and while they have a desk job type of thing, then they can every 20-25 minutes they just can roam around for 5 to 10 minutes in their office. That all leads to reduction in obesity. Sitting ideally at a place on the computers, that leads to lot of gain in weight, causing obesity. The other factors is the stress. We all know that the stress, especially in today's world, has increased because of the job competition, because of the peer pressures, and because of the lot of people getting night jobs, going with the Western timings. It has led to more of stress, and the stress has directly been shown to reduce to increase the chances of heart disease. And it has been clearly shown that ones who can modify the stress by means of yoga and other physical activities definitely will have a high chance to reduce their heart disease. But definitely there is some amount of stress is required for our daily activities, but unacceptable stress in the form of workplace or in the form of domestic relationships between families, that leads to heart disease. Apart from this all risk factors, there are 3 risk factors which can reduce the chances of heart diseases, what we call as a positive factors for heart disease. One of them has been physical activity. One who is more physical active, whether they are overweight or not, whether they are normal weight, physical activity itself reduces the chances of heart diseases. So one who is more physically active, definitely the chances of heart disease is less. As a routine, one can do a 20 to 30 minutes of brisk walking, or something like a cycling, swimming, or some sporting activities like badminton or basketball. That will definitely have a good effects on your heart diseases. It increases your collateral circulations, so the chances of heart disease are reduced, and even if you get a heart attack, the heart attack is definitely a minor one. So in all respects, one should always go into some physical activity, if possible at their workplace, or if then otherwise a routine morning walk will do the same thing. Regarding the dietary effects, we all know that there are certain food that reduces the heart disease. It has been well shown that the fruits definitely, because of the good properties of antioxidants and lot of heart protecting vitamins, they all reduces the heart disease. Many studies have clearly proven taking regular fruits in the form of 3 to 4 portions per day definitely reduces the chances of heart disease, heart attacks by 25%. Along with fruits, one should also give lot of importance to dry fruits in the form of nuts and like almonds, walnut. They all leads to reduction of heart disease. One should take a handful of nuts every day, and that has a good bearing in reducing your cholesterol levels, reducing your obesities, and reducing your diabetic patterns also. So all these things all lead to reduction of heart disease. Finally, I would like to say that there are many risk factors that you should all know. There are few, what I have enumerated are 8 to 9 risk factors where you should all be aware, and definitely you should take care of your these risk factors. This all will reduce the heart disease, and the chances of heart attack is definitely reduced. You should meet your physician regularly if you have any of these risk factors like a diabetes, hypertension, or hypercholesterolemia, and get regular checkups and try to maintain a good sugar levels, blood pressure levels, cholesterol levels that may reduce the heart disease. And definitely you should be regularly doing exercise, you should control your weight, the smoking should be reduced. All these things leads to reduction of heart disease. There are certain other factors which cannot be modified like age, male, and genetic factors. Bothering too much on those will not lead to any benefits. Rather, you should focus on your risk factors which will definitely reduce the heart disease.